All right, November is Lung Cancer Awareness Month, and we have Dr. John Lazar here with us. He's a thoracic surgeon at MedStar Health Angelo Center for Lung Diseases. Doctor, thanks so much for joining us.
Thank you for having me.
So talk to me about surgery. When is surgery used as an option for someone who has lung cancer?
So surgery is a very focal instrument for dealing with cancer. You'd have to be in the early stages, either stage 1 or stage 2. You would also have to have good heart function, good lung function, overall good performance in order to handle the surgery.
So, I mean, you have to be a good candidate. I was going to say, is surgery the best option for everyone?
Well, I'm a surgeon, so I'm probably a little biased. But for early stage, I think the data shows that surgery is the best option if you're a good candidate. It has the best overall survival. When I counsel my patients, part of the reason is that we are able to look at the lymph nodes that are within the chest, and the lymph nodes are part of the staging. The staging determines treatment. But if you're unwilling to undergo surgery, and some people just don't want to do it, and that's completely reasonable, and the lymph nodes are unaffected, then there are other ways to handle the disease, such as with radiation.
You're looking next door at our studio where our experts are standing by taking your calls from MedStar Health. The number to call if you have a question is 410-671-0702. So doctor, is the CyberKnife, is that a type of surgery or no? Just direct radiation?
That is a type of radiation that is run through a computer, exactly.
Talk to us about the robotic surgery.
So robotic surgery it's sort of a misnomer. It's not really, it's not really robotic surgery. The robotic surgery that we do is actually the surgeon controlling the robot, and the robot is really telepresence, meaning the surgeon is sitting at the console while the robot is at the bedside with one of our assistants. I'm controlling all of the movements. What the advantages of the robot are basically it allows me to look at things in 3D, whereas in traditional minimally invasive surgery, it's basically like looking at the TV screen, which is only 2D. In addition, my hands only can go so far. With the robot, they can go 360 degrees. So it's almost like being inside the patient's chest while you're dissecting out the structures. So it's almost being like this.
Okay, Dr. Lazar, thank you very much. One of our many fine experts from MedStar Health here taking your calls.